Earlier this month, the U.S. reached a tragic milestone. In 2021, more than 100,000 people died from drug overdoses. It's a new record. Opioids account for nearly 2/3 of those deaths. Opioid deaths have been a challenge for decades. The Center for Disease Control estimates that between 1999 and 2019, 500,000 people have lost their lives due to opioids and prescription pills. Well, between 2015 and 2020, Montana reported a total of 745 overdose deaths, with the highest number of deaths, 287 in a 2-year period, encompassing 2019 and 2020. On our series, Two Americas, we aim to share the perspectives of those who you know and may not know. I spoke with one Montana woman who says she became addicted after she was prescribed opioids by her doctor. Well, she is now sober and wants others that are fighting addictions to get help. Earlier this month, the U.S. reached a tragic milestone. In 2021, more than 100,000 people died of drug overdoses. And opioids, they accounted for 2/3 of those deaths. Opioid deaths have been a challenge for decades. The Centers for Disease Control estimate that between 1999 and 2019, 500,000 people have lost their lives to opioids and prescription pills. Between 2015 and 2020, Montana reported a total of 745 overdose deaths, with the highest number of deaths, 287, in the 2-year period, encompassing 2019 and 2020. I spoke with one Montanan who says she became addicted to prescription pills after her doctor prescribed them to her. She's now sober and wants to help others on the road to recovery.
I grew up very lucky in a very loving, very supportive family.
Sarah Grant started taking prescription pills when she was a teenager after having some health issues.
A lot of lung issues, and I was hospitalized in the ICU very seriously for pneumonia several times. And so my pulmonologist was prescribing me 150 codeine, 100 oxycodone every month.
Sarah says she became addicted to opioids.
I got very hooked on pain pills.
Grantham says by college, she was hiding her addiction from her friends.
Pills are not socially acceptable. I was in a sorority, so I would take pills before we would drink. And I'd be 2 drinks in, and my roommates and my boyfriend would be wondering, why is she passed out on the floor of this party?
She tells me she feels there are misconceptions when it comes to addiction being considered a disease.
Once you start using, you lose that power of choice because you are hooked and all you are looking for is your next drink or your next drug, and you have lost that power of choice, and people without addiction do not understand that.
For those that are wanting to seek help, there are options. There are support groups that are located all throughout the state of Montana. For more information, visit our website. In Helena, I'm Phoenix O'Connor, MTN News. When it comes to prevention, education, and policy, well, they play the key role. House Bill 86 passed by the 2019 Montana legislature created new controls in the state around opioid prescriptions. It also created a registry and requires most doctors and pharmacies to check before prescribing or filling prescriptions. It also limits some patients to no more than a 7-day supply of the drug. Dr. Maggie Cook-Schremer, who is the acting DPHHS state medical officer, says there are guidelines in place for prescribing opioid drugs.
When opioids are used in the clinical setting now, the emphasis is really on prescribing the lowest effective dose and limiting the quantities prescribed, specific to the clinical situation.
Well, for those that are wanting to seek help, there are some options. Our place offers a support group from 1 to 1:30 on Thursdays and 9:30 to 10:30 on Tuesdays. There's also Alcoholics Anonymous, Narcotics Anonymous, and Smart Recovery.